Good afternoon. Thanks for joining us for today's ZOHU call. The webinar will begin soon. Please stand by. Good afternoon. I'm Keisha Bohannon, and I work in the National Center for Emerging and Zoonotic Infectious Diseases at the Centers for Disease Control and Prevention. On behalf of CDC's One Health Office, welcome to the November 6, 2024 Zoonosis and One Health Updates call. Next slide, please. Although the content of this webinar is directed to veterinarians, physicians, epidemiologists, and related public health professionals in federal, state, and local positions, the CDC has no control over who participates. Therefore, please exercise discretion on sensitive content and material as confidentiality cannot be guaranteed. Today's webinar is being recorded. If you have any objections, you may disconnect now. Links to resources from each presentation are available on our website at cdc.gov/1-health/php/trainings-events/november-2024-zohu-call.html. Next slide, please. Today's presentations will address one or more of the following 5 objectives. 1, identify an implication for human, animal, and environmental health. 2, identify a One Health approach strategy for the prevention of public health threats. 3, identify a One Health approach strategy for detection of public health threats. 4, identify a One Health approach strategy for responding to public health threats. 5, list 2 ways to improve collaborative practice across the public healthcare team. Next slide, please. In compliance with continuing education requirements, all planners and presenters must disclose all financial relationships in any amount with ineligible companies over the previous 24 months, as well as any use of unlabeled products or products under investigational use. CDC, our planners, and presenters wish to disclose they have no financial relationships with ineligible companies whose primary business is producing, marketing, selling, reselling, or distributing healthcare products used by or on patients. Content will not include any discussion of the unlabeled use of a product or a product under investigational use. CDC did not accept commercial or in-kind support for this activity. Next slide, please. Instructions for receiving free continuing education are available at cdc.gov/1-health/php/zohu/index.html. To receive free CE for today's webcast, sign in or create an account at train.org by December 9th, 2024. The ZOHU access code is ZOHU Webcast. A captioned video of today's webinar will be posted on our November call page within 30 days. Free CE for the web on-demand video of today's webinar will be available until December 10th, 2026. Next slide, please. Before we begin today's presentations, CDC One Health Office ORISE Fellow Dominic Cristiano will share some news and updates.
Thanks, Keisha. Hi, everyone. Good afternoon. Thanks for joining our November ZOHU call. Just a note, please remember to share the ZOHU call website link with your colleagues from public health, agriculture, wildlife, plant and environmental health, and any other sector so we can let them know about the live and recorded webinars and the free continuing education that this webinar offers. Before we get started with the presentations in a moment, I'll just share a few quick updates and resources. You can find links to these resources in today's ZOHU call email newsletter. And if you aren't subscribed to that newsletter, feel free to sign up using the link on our main ZOHU call webpage so that you'll get these kinds of updates moving forward. So to begin, CDC is working closely with federal and state partners to monitor H5 bird flu activity in people, wild birds and poultry, dairy cows, and other mammals. You can find the latest updates on CDC, USDA, and FDA's websites, including situation updates, recommendations for protective actions for people, confirmed cases in domestic livestock, and more. Next slide, please. In today's newsletter, we're highlighting several recent publications, including an MMWR on the reemergence of Oropouche virus in the Americas and risk for spread in the United States and its territories in 2024, and another MMWR on the evidence of human bourbon virus.
Whoops, we might have lost Dominic.
Can you hear
Can
me
you?
okay?
Yes, I hear that you're back. Okay, please continue.
Sure. Let me repeat this slide again really quick. Today's newsletter, we're highlighting several recent publications, including an MMWR and the reemergence of Oropouche virus in the Americas and risk for spread in the United States and its territories in 2024, and another MMWR on the evidence of human bourbon virus infections in North Carolina. Next slide, if you can still hear me. Great. We've also got additional recent publications, including One Health Best Practice Case Study, Advancing National One Health Coordination in the United States through the One Health Zoonotic Disease Prioritization Process, and a publication titled One Health Investigation into Mpox in Pets, United States. Next slide. And on this slide, we've got additional publications, including a conceptual framework for community-based prevention of a brown dog tick-associated Rocky Mountain spotted fever. Next slide. The newsletter also highlights recent announcements and resources, including a press release on a Lassa fever suspected death of a U.S. traveler returning from West Africa, and the G20 Health Ministerial Declaration on Climate Change, Health and Equity, and on One Health. Next slide. We're also highlighting a recent webinar recording from Clinician Outreach and Communication Activity, known as COCA. We're sharing a similar topic today on the resurgence of New World screwworm in the Americas, what healthcare providers need to know. Next slide. Some November observances that may be of an interest include One Health Day, which just occurred this past Sunday, U.S. Antibiotic Awareness Week 2024, which is November 18th through the 24th, and a virtual event, the Center for Veterinary Medicine One Health Symposium, Paws, Claws, Hooves, Fins, and Feet, Advancements through the One Health Approach on November 19th, 10 a.m. to 5 p.m. Eastern Standard Time. Next slide. And finally, we've shared several new and ongoing outbreak investigations, including an E. coli outbreak linked to onions served at McDonald's. Next slide. You can visit CDC's Healthy Pets, Healthy People website for a selected list of ongoing and past U.S. outbreaks of zoonotic diseases. And linked from today's newsletter, you can find details about additional ongoing U.S. outbreaks. Our next ZOHU call is going to take place on December 4th, 2024. And as always, please continue to send presenter and topic suggestions for future presentations, as well as any news from your organization to zohucall@cdc.gov. Next slide, and back over to you, Keisha.
Thanks so much, Dominic. All right, so you may submit questions at any time using Zoom's Q&A feature. Please include the topic or presenter's name. The Q&A session will follow the final presentation if time permits. You may also email questions to today's presenters. We've included their email addresses on the slide and in today's newsletter. Now we can begin our presentations. Next slide, please. Doctors Bridget McFarland and Anne Straley will share the first presentation titled Reemergence of New World Screwworm in Central America. Please begin when you're ready.
Thank you very much. This is Bridget McFarland. I'll pass the second half over to Dr. Anne Straley to talk more about her side within CDC. My name is Bridget McFarland. I'm with USDA APHIS. I serve as the Biological Operations Manager and Agriculturalist for the New World Screwworm program down in Panama. Next slide. So the program down in Panama is called COPEG. It's a Spanish acronym that stands for the Panama United States Commission for the Eradication and Prevention of Screwworm. This is a bilateral cooperative agreement between the USDA and Panama's Ministry of Agricultural Development, or MIDA, and it was signed in 1994. The purpose of this is to eradicate New World screwworm from Panamanian territory and prevent its reinfestation. Currently, we employ about 570 Panamanian nationals, but the COPEG Commission staff are composed of MIDA, USDA APHIS, USDA ARS, and COPEG personnel. The production plant that I manage is located in Pecora, Panama, and it was inaugurated in 2006. It's currently co-managed and co-funded by USDA and MIDA. And then our primary dispersal center is located in Tucumán International Airport in Panama. Throughout the country, we maintain 29 outposts throughout all of Panama from east to west, and we also have 6 movement control posts for animals. Next slide. So here we're going to go over, I want to walk through the life cycle of a screwworm. All in all, it's about 21 days in favorable environments. I'm going to start with the gravid female fly laying its eggs. This fly will find an open wound or bodily orifice on a warm-blooded animal. These wounds can be as small as a tick bite, and screwworms only lay their eggs on living animals as their obligate primary parasites. So on average, a female will lay anywhere from 200 to 300 eggs, and these can either be laid in a single egg mass, 2 egg masses, or split between multiple locations. Between 24 or 12 hours, the eggs will hatch after being laid, and these larvae begin to feed for the next 5 to 7 days. They grow in size, and they burrow deeper into the animal. The second and third instar larvae resemble a screw. They're cylindrical, and they've got the brown spines, as you can kind of see in this image. And they've got a tendency to burrow deeper into the wounds of the animals. After these larvae feed and reach the third instar, they actually leave the wound and fall off onto the ground to burrow into the soil and pupate. Anywhere from 3 to 5 days after that, adult flies will emerge to feed and mate. Something important to note is that the female flies will only mate once, but male flies can mate numerous times. So when you think about this life cycle at the COPEG production facility, we utilize the sterile insect technique to mass produce screwworms, sterilize the pupae using radiation, and then we airily disperse the sterile flies by airplane. The goal is for the sterile COPEG flies to mate with the wild fertile flies. Since no offspring will then be produced, if this mating occurs, SIT will lead to a drastic reduction in the wild fly population. Next slide. And you can begin the video if you'd like. So this is a time lapse and heat map of the progression of positive cases in Central America region starting in January 2023 up until about middle of October or Epi week 41. So you'll initially see the cases in the eastern part of Panama. That was the previously established barrier zone next to Colombia. Then by July, cases had crossed over the Panama Canal and into the western part of Panama, and then the peninsula on the southern part. By the end of July and August, we saw that cases had reached the border of Costa Rica. And then we're getting closer to March of 2024, which is when you'll start to see cases popping up in Nicaragua. And ending in September, where the first cases were detected in Honduras. Next slide. Thank you. So this is just kind of breaking down the regional statistics. And like I said, it's similar to the last video, so it's just up until Epi week 41, which is about mid-October. Since the beginning of this emergency, the COPEG production facility has increased production from 20 million sterile flies per week to over 90 million sterile flies per week. And we are currently conducting 18 to 21 dispersal flights per week. Next slide. So here's some information on animal case data that we have for Panama. It'll be interesting to talk about the top 10 causes of myiasis. Screwworm infestations are very common in the navels of newborns, also from various cuts that animals might get as they're naturally moving around a farm, and then also from vampire bat bites. It's important to note that some of these causes, like the umbilical wounds, ear tag, and dehorning, are all directly related to animal husbandry practices that the producers are involved in. For us, this is a signal, this is demonstrating the importance of good practice and education. Next slide. Now looking at the cases by species, and this is just for Panama for this calendar year. The majority of screwworm infestations are detected in bovines, followed by canines, and then porcine. Human cases, for example, you see on the side, make up less than 1% of these over 19,000 cases since the start of the calendar year, but they are present. Next slide. So for the human cases within Panama, we have reported cases throughout the entire country of Panama, as you can see here on the map. The majority of affected areas are from wounds in the arms or legs or somewhere on the head. Next slide. So as I mentioned earlier, one of the 3 pillars of COPEG is to use the sterile insect technique. While we've expanded and continue to expand the production and dispersal capacity of the sterile insect, it's important to note the sterile fly cannot eradicate or work alone. So that brings us to the other 2 essential pillars, which are regulatory controls and field surveillance. So for regulatory controls, this involves enhancing quarantine practices, reviewing the movement of animals, and having inspection checkpoints for these animals. For field surveillance and stakeholder engagement, we've worked hard here in Panama to enhance the sanitary education materials and information that is shared with producers that's related to animal care, husbandry, and breeding practices. COPEG is also the WOA World Reference Laboratory for New World screwworm, and with over 20,000 samples this year alone, we've been working hard to expand our identification capabilities. Next slide. So some key messages for producers. As part of our field surveillance and stakeholder engagement, these are the 4 main messages we want to transmit to all of our producers. The first is the importance to review your animals to see if there are any wounds or myiasis. The second is to treat wounds with the approved medication or pesticide. Here in the picture is one of the curative powders that our VMOs and inspectors have on hand as they do regular farm visits. The third is to take and submit samples. It's important that when treating the wound, all of the larvae and or flies come into contact with the product, and that none of the larvae are untouched or fall onto the ground, as this could lead to a reinfestation. And finally, the importance of transporting only healthy animals. Our studies show that the screwworm alone can travel up to 10 to 20 kilometers in the tropical environment. However, cattle can be transported throughout entire countries. So it's extremely important that we are only transporting healthy animals. Next slide. For engagement with surveillance and education and sanitary education, COPEG offers workshops, hands-on trainings, and then a 1-800 number. In Panama and most Central America, WhatsApp is much more common. So we've developed a 1-800 number on WhatsApp, and that allows producers to report cases, ask our specialists for information, or get in touch with their area's veterinarian. We also have a number of informational brochures that we partner with regional groups to develop and disseminate. Next slide. So APHIS is actively engaged in a variety of regional partnerships in this emergency, one of which is with OIRSA. It's the International Organization for Plant and Animal Health. This is focused on capacity building and the reinforcement of technical operations, specifically with veterinarians. Another one is IZICA, the Inter-American Institute for Cooperation on Agriculture, and this is mainly to focus on outreach and communications materials. Next slide. And then all of this emergency very much ties into the One Health approach. APHIS is actively working throughout the region with respective ministries of health, wildlife and environment, and agriculture. We're encouraging countries to fund and staff animal health and quarantine activities, and we're working collaboratively with local, national, and global groups on the technical aspects of New World screwworm eradication, control, and prevention activities. Next slide. And I'll pass it over to Dr. Ann Straley.
Thanks, Dr. McFarland. Hey, everyone, I'm Dr. Ann Straley with CDC's Parasitics Diseases Branch, and we're going to switch gears a little bit for the last few slides here. So as Dr. McFarland mentioned, USDA is leading this response, and we at CDC are collaborating with USDA, other federal agencies, and international organizations to monitor the outbreak and assist with efforts to control the spread further north. We're providing training and consultation to public health agencies and human healthcare providers in the region, and simultaneously, we're working to prepare healthcare providers and health departments here in the United States so that we're ready should a case be identified. Next slide, please. So what do healthcare providers, veterinarians, and health departments need to be aware of now? New World screwworm is not currently in the United States, but introductions are possible. We have seen cases of New World screwworm in travelers returning to the United States after visiting endemic areas, so vigilance is needed to protect both animal and human health. Next slide, please. So when should New World screwworm be suspected? Remember, it's not currently in the United States, so a history of travel to an endemic area or to countries in Central America that are currently experiencing reemergence of New World screwworm is a key risk factor. So collecting a good travel history is important. The lesions caused by New World screwworm are very painful. People with infestations often report feeling the sensation of movement, and malodorous bloody discharge is frequently present. Larvae may be visible in or around the wound, and there can be extensive tissue invasion and destruction. These wounds may become secondarily infected, which could also result in symptoms like fever or chills. The picture on the right-hand side of this slide features a New World screwworm larvae on the right, that's the small guy on the right, and then a botfly larvae on the left. Now, botflies are endemic to many of these same areas where New World screwworm is a concern and are not terribly uncommon in travelers returning from these areas, so correct identification of the larvae is important, which we'll talk more about in a minute. Next slide, please. So if you do suspect a New World screwworm infestation in a patient, the most important thing to do is to remove and kill all of the larvae. All suspected larvae should be collected and placed into a leak-proof container with 70% ethanol, and the volume of the liquid should be enough to fully submerge all of the larvae. The ethanol will both kill them and preserve them for identification. If you don't have 70% ethanol, you can substitute 70% isopropanol or 5 to 10% formalin. Remember, it's crucial to remove and kill all of the larvae. Do not throw any of the larvae away in the trash. Next slide, please. Suspected cases in humans should be reported to your state or local health department. CDC is available to help healthcare providers and health departments with identification of the larvae. So if you suspect a New World screwworm infestation, you can email either dpdx@cdc.gov to request diagnostic assistance, so to help identify the larvae, or you can contact the Parasitic Diseases Branch by emailing parasites@cdc.gov or calling 404-718-4745. Suspected cases in animals should be reported immediately to your state animal health official and USDA APHIS, and we've shared the email address here. Our colleagues at USDA APHIS are available to provide consultation on suspected animal cases, and more information is available on their New World screwworm website. Next slide, please. And finally, just to wrap up, there are a number of resources available on CDC's website that are listed here, including a New World screwworm general information page and a clinical overview of New World screwworm that's geared more towards healthcare providers. And both of those pages are available in Spanish. We've also developed a bench aid for identifying the maggots, but if you suspect a New World screwworm infestation, please do contact us for confirmation. Additionally, my colleague, Dr. Rebecca Chansey, did a clinician outreach and communication activity, or COCA call, last month on the resurgence of New World screwworm in the Americas for healthcare providers. And a recording of that presentation is now available online in case you missed it. And I believe the link was also included in this month's ZOHU call letter. So I think that wraps up our portion of the presentation. Thank you very much for your attention.
Thanks so much, Dr. Straley and Dr. McFarland. Please, next slide. Our second and final presentation will is titled Understanding the Environmental Dimensions of Antimicrobial Resistance from Developing One Health Surveillance to Evaluating Mitigation. This will be presented by Dr. Jay Garland. Please begin when you're ready.
All right, thank you. Appreciate the invite, and I'm glad to incorporate a little environmental kind of discussion within the overall One Health meeting here. I'm the single author on this slide here, but I've got a slide later on that indicates that the work I'm going to describe is a really collaborative effort amongst many of us within the Office of Research and Development, which is the research arm of the US EPA, as well as a number of other collaborators in FDA, CDC, and USDA. Next slide. So I want to give you a little bit of background on the environmental dimensions of this question, since that may be something that some of you are not as aware of. Talk about a pilot US monitoring program for antimicrobial resistance. Talk about the development and implementation, design of the sampling that we did both from local to national scale, and really focus a lot on what the analytical targets are for this approach. And I should tell you right now, I'm not going to show you a lot of data from the study. We developed and implemented this study, including over 2,000 samples across the U.S. in surface waters, and that work is just completed. The sampling phase is completed, and we moved into the data analysis phase. But I also want to talk about, finally, just briefly talk a little bit about beyond monitoring, thinking about, the One Health surveillance is important to study linkages amongst the different domains of One Health, but the data itself needs to be translated into risk models, and that's something that we're actively engaged in, and also really thinking about how do you mitigate the environmental component of AMR, particularly from the EPA perspective, since we regulate surface water discharges from U.S. Municipal wastewater treatment plants, focused on that aspect in particular. Next slide. So, the antimicrobial resistance is one of the major issues and public health threats of the 21st century. I didn't include the data on disease rates, both currently and projected, but I figured this audience would be aware of those. But just to mention briefly, it's thought that projected up to 10 million people annually will die of antimicrobial resistant diseases by 2050, and that would exceed the present number for all cancers combined. So this is a significant issue, and in response to that, the U.S. as well as other nations have developed national action plans. And because of the complexity of the issue, the national action plans incorporate both trying to look at development of new antimicrobials and all that that organisms aren't resistant to, but also look at reducing infections and developing better diagnostics. But one element is this One Health kind of approach and One Health surveillance that is found in the National Action Plan in both the U.S. and in other countries. And that's kind of what I'm going to focus on. Next slide. And AMR is a unique and complex environmental contaminant, both on the one hand, because it naturally exists. Antimicrobial resistance is something that we get from the environment, that originally those organisms were present in the environment and recovered and isolated and used for therapeutics. But there's other examples of natural compounds that can be toxic, can be contaminants, right? Because the dose is very important. But the more complex thing about AMR is that it's not just the release of, say, the multi-drug resistant organism into the environment that you have to be concerned with, but you also need to understand the exchange, the release and potential exchange of the genetic material conferring the resistance. And that's the AR in this graph. You have the original antimicrobial resistant bacteria, but you also have the resistant genes that the organism contains, and those are oftentimes on mobile genetic elements that can be exchanged. So when we think about the multiple components of the One Health spectrum, ag, built environment, and people themselves, and the natural environment, we need to understand both the movement of the organisms and the genes amongst those. And it could be that while the original organism may attenuate in the environment, there may be factors that would select for amplification of the resistance in a non-target organism that could still represent a pathogen, a risk. Next slide. So this idea of One Health applied to just the environment in particular. I got this quote from a paper back about 6 years ago, which talks about, we all talk about One Health, but when it comes to the environment, a lot of times we can point to, we think something happened in the environment, almost like we can sketch out the chalk lines of the event, right, in the environment. But do we really fully understand the dynamics of that crime scene? Do we understand what's going on in the environment as part of this? And this paper talks about really the issue here is there's a lack of communication amongst the different domains that limits that kind of understanding. And that's really something that we try to do here with this effort, as I mentioned earlier, about trying to really link across the different domains. Next slide. Now, this idea of lack of communication, this slide here shows a very recent review article on looking at the interconnectedness between sectors, in this case, not just general One Health issues, but One Health AMR studies. And I know this is a very complicated graph, but what they've done here, they did a AI assisted literature review. And what they demonstrated is that these different phases, which don't go back that far, it starts in 2003. They broke it up into 3 different phases, the most current one over the last 4 or 5 years. And the heat map there shows the interconnection between these different domains of human, animal, plant, food, and the environment. And those network graphs up on top, those network analyses that show connectiveness between the studies, between the different domains in the studies, what they show is that there is increasingly dialogue and stated interactions between the different domains as part of these AMR studies, which is good. So the good news is there is more communication going on. The one thing that these authors emphasize is that a lot of the communication and the difficulty in communication comes in the fact that the different sectors bring different analytical perspectives to the issue. In the human domain, greatly, and the disease dynamics, both in animals and humans, there's a focus on the disease itself, and the methods for looking at the resistance are what we would call culture-based, right? Where you're culturing the organism, you're isolating it, and then you're studying it, you're looking at the resistance patterns in it. That is very important, and that is what is driving the disease risk specifically. But when you talk about the environment and you want to understand the movement of the genes, there are increasingly applied molecular techniques, both in terms of quantitating the resistance genes, the ARGs, and then also more deeply looking at the metagenomic profile of what genes and genome is out there in the environment. And because I think the environmental world, that is kind of because we are dealing with this complexity within the environment, we tend to want to use those tools. And as part of this study, one of the key factors was developing an analytical approach that really brought all of those different approaches to the table, i.e. culture, targeted gene analysis, and metagenomics, to facilitate that discussion and the collaboration across the sectors. Next slide. This outlines some of the issues related to kind of gaps and research needs in the environmental dimensions. This is from Larson et al., again, about 6 years ago. But I think these core areas are still very, very important in terms of understanding the environmental component here. One is you want to understand what is the relative contribution from different sources. What is pushing, what is contaminating the environment above what maybe background levels of AMR in the environment. That's one issue. The second one is understanding the role of the environment on the evolution of resistance. So again, what I mentioned before about maybe amplification of those genes in non-target organisms, and therefore also evolution of the resistance itself. The third issue is that, again, you can measure these things in the environment. That's critical. That's a baseline, but you have to try to translate it into human and animal health impacts. So understanding the exposure linkages from the environment to both human or animal targets. And then finally, try to look at what are the efficacy and feasibility of different interventions based on the knowledge of where it's coming from and what factors may be leading to the amplification and also the exposures, as I mentioned. So that's kind of the broad reaching kind of issues related to the environmental dimensions. If you go to the next slide, it reflects these 2 boxes. The first one on the top is another review article that was done about the same time frame, looking at the issue of AMR in the environment. And I note there are some specific text from that report that talks about environmental waters as one of the areas of concern and study. And they emphasize, number one, understanding what is the geospatial distribution of resistance. So understanding where it is, and also understanding it, not just to measure it, but to try to inform risk. Secondly, understand what the sources are and also what the selective pressures for amplification and transmission are. And then finally, emphasizing defining and standardized sampling and analysis methods, because there is increasingly, as that AI assisted lit review I just showed, there's a lot of information being generated. Trying to standardize the approaches being used is really critical so that we can compare cross methodologies. So all of this background kind of formed the basis of the NARMS program, which is the National Antimicrobial Resistance Monitoring System, which has been in place now for almost 3 decades, right? Looking at AMR in the food chain. In their most recent strategic plan, the current one from 20 to 25, they've decided to look at incorporating a environmental component into that One Health monitoring. And we selected environmental waters, surface waters, as the first part of the environmental component to look at as part of that. That's that One Health surveillance. It's surface water isn't the only component of the environment to look at. Certainly, there are plenty of other ones where there are microbes that could be of concerns. Biofilms, for example, also soils and other active microbial sites in the environment. But surface water was selected for a couple reasons. One is that it is a source of movement of AMR through the environment, and it also, when you measure surface water in the watershed scale, you can then look at the different inputs that are affecting the levels in the environment by understanding the impacts to the environment into that surface water. The next slide will kind of show a little bit more of that. Well, this just reiterates what I mentioned earlier. This is an interagency collaboration. The NARMS team really reached out to EPA. They've helped fund some of the work that we're doing, and we were able to leverage some of our ongoing surface water monitoring program so that we can most effectively kind of deploy this pilot effort very quickly. And so those names there really represent this collaboration across sectors, and it's really been, I think, in my mind, one of the most, it's at certain points challenging, but the most rewarding parts of the effort. Next slide. And so this question of why water, as I mentioned, there are multiple inputs to watersheds, and trying to understand what those different sources are, and then understand the levels in the environment and how it may be moving around within the watershed and different exposures. That's why we kind of selected water. These graphs show on the top two, there are different inputs of human fecal matter, which contains AMR, into the environment. The graph on the right there with the dots, that is just shows where there are combined sewer overflows. So that is untreated sewer that during rain events flows into our surface waters. The graph on the left hand shows that that's a graph a little more complex, but it shows the percentage of drinking water uptake at different cities that actually is treated wastewater. And so that could be considerable in a lot of areas. And that shows that there is both treated wastewater inflow into the environment and also into human exposure, but also there's untreated wastewater sources too that you need to be concerned with. And then the bottom graph shows, it's a map from our EnviroAtlas that shows the animal manure loading into different sewer sheds, which can be another source. So multiple sources and movement of water. That's why we're selecting surface water as a pilot. Next slide. And so this work, the surface water AMR monitoring, or SWAM, that the program was developed, the overarching goal was, as I mentioned earlier, the pilot environmental effort within a One Health focused NARMS program. And as we developed this, we wanted to develop a national scale quantitative assessment of AMR. National scale because we really wanted to be fit into our national action plan. And also in terms of a quantitative assessment, we really wanted to develop data that could hopefully inform the developing risk models for what this really means, right? So we didn't want to just go out and say, yes, it's there or it not, but really try to look at the levels. And so we feel like we want to develop a plan that provided standardized measure and also a library of samples for further later work to monitor what the long-term trends are as part of NARMS, but then also try to develop in a way so we could address some of those other factors that I mentioned earlier that are important for the environmental work. Understanding the risk, understanding what the drivers are for occurrence and selective pressures for amplification, and then potentially helping use this data for identifying critical control points and therefore mitigation. Next slide. And so as we developed the plan, one of the big first steps was, well, do you want to go big and slow or small and fast? And when I say big and slow, I mean, okay, you want to look at the entire nation, you want to go big, and we do, but if you do that, it may be hard to look at really high frequency at that kind of scale, especially given limited resources. That upper graph, the figure there shows our National Rivers and Streams Assessment Program, which captures is a probabilistic survey of all the river and stream kilometers in the US. And the different colors in that map represent, in the top graph, the different colors are the different ecoregions within the US. So as we developed that study, we wanted to be able to account for differences. In this case, we do water quality sampling, but we also do biological sampling, fish, invertebrates, algae, etc. So this program, NERSA, is really meant to look at impairment of waters across the U.S. So it's probabilistically designed so that we can map out the level of impairment across all the rivers and streams. So we were able to leverage that as part of this study in going big and slow. And it's slow means we only do that once every 5 years. We go out and sample those 2,000 data points for a probabilistic survey of the state of the rivers and streams. But that's one sample done near base flow conditions, not storm events, base flow conditions in the summer. And then the bottom graph is that we know that, as I just mentioned, there's CSO events, there's runoff, there's stormwater inputs, there's lots of inputs into the environment. That bottom graph is from some of our colleagues from CDC looking at levels in the Chattahoochee, in which you can see there's a strong impact of rain events. So you wanted to really capture both those things. And our study design really tries to capture that by leveraging existing studies that EPA in place both at the national scale and at the watershed level or smaller scale. Next slide. And so this is an overview of the plan. Again, it's the statement of our overall goals. And then on the left-hand side, the map, both on the bottom is NERSA, and the top is the watershed called the East Fork of the Miami River, which is near our labs in Cincinnati, where a lot of us are located within the Office of Research and Development. And so our plan, the pilot effort, which is running the sampling, just finished. We said summers FY23 and 24. Those 2,000 samples are collected across the U.S. They're collected half in one summer, half at the next summer. And that national scale study just completed. But and before that, we did the watershed scale study in the East Fork. But even prior to that, we spent a good amount of time both planning the design of the experiment, but also developing and standardizing the methods that we're going to use. And then the idea is that this pilot would lead to potentially future studies. And I'll talk about this a little bit at the end. It's like our plan here is to use this pilot to determine if this data is valuable for NARMS. And if so, what's the optimal configuration of the sampling plan that we would employ for NARMS. So next slide. So I want to talk a little bit about the analytical targets. I mentioned earlier in that article review that we really wanted to kind of look at this tripartite approach, look at culture-based approaches, targeted gene analysis, and metagenomics. Culture is great, but it's the most expensive and time-consuming part of it in all those samples. We focused on enterococci and E. coli because those are commonly used water quality measures based on fecal indicators. But we've looked at resistance as part of that, both the susceptible, pan-susceptible E. coli and enterococci and resistant forms of enterococci and E. coli. And then we also built in salmonella because that's very important for the NARMS program and the food web. I mean, basically the food cycle. So we looked at that as well. In that case, we're doing an enrichment for salmonella from the environment. So it's more presence absence, not absolute levels. And then we do targeted gene analysis, a whole set of different genes, as well as fecal indicators and pathogens in these samples. And then beyond that, look at metagenomics to really look at what maybe it's slightly less quantitative, but broader in scale. So you can look at the entire microbiome, the entire resistome in these samples. Next slide. Just a little more background on the culture methods. We're using modified methods for E. coli and for enterococci. Again, we're looking at the susceptible forms of them, but also looking at, in case of E. coli, ESBL or cefotaxime-resistant E. coli. And then also for enterococci, looking at susceptible enterococci, but vancomycin-resistant or DRE. And then finally, like I said, salmonella, we're just enriching for salmonella. We're not enriching just for resistant forms, but whatever salmonella we recover, we're going using whole genome sequencing to look at what resistant patterns are there. And the reason, as I mentioned, these are standard methods. They're used. The Water Research Foundation and leaders in the field, Amy Pruden from Virginia Tech, had a grant from WRF. They're using very similar methods, so we're trying to be consistent and trying to develop kind of a state of the science for consistent methods for this. We also use those standard methods when we look at beach surveys to look at the risk of swimming and recreational exposures, which again, and AMR could be one of the routes for exposure. And then the isolates, then we have the isolates, all the isolates we generate, we feed back into the NARM system. They can do the whole genome sequencing, and that really then allows us to make linkages across the domains for the whole genome sequencing of the environmental isolates, as well as ones they have in their other domains from their ongoing work. Next slide. And then the metagenomic work, this is another network analysis graph. If you haven't seen these network analysis, it kind of shows that the nodes at the end are representative of maybe what's unique to those samples, and you may not be able to read all those words, but those are ARGs that are specific to that sample source. But then there's also the nodes in between, which are shared resistant genes amongst these patterns. And this is work that was done from our FDA colleague, and it compared some of the samples from an early NERSA sampling, that nationwide survey we did, early sampling of that, compared to some of the metagenomes they had for some cecal samples from animals that they monitor as part of NARM. So this graph just shows you kind of what we hope to do with the data once we have collected in at fuller scale from the study that I mentioned earlier. Next slide. Real quickly, not to get too bogged down into methodologies, but the third kind of element of the analysis is molecular analysis, more targeted gene analysis. We use the biomark, which is a microfluidics channel that allows for rapid assessment of multiple genes in a quantitative way. In this case, we're looking at 96 total targets, a range of antimicrobial resistance genes. As I mentioned, different fecal indicators, so we can try to relate the source of fecal contamination in the surface water to different kinds of genes. And then also do a limited number of pathogens. Next slide kind of just shows the details on those and just what those ARGs are in the panel, as well as what the pathogen markers are, and the different MST is the microbial source tracking what the source of the fecal contamination is. So next slide. And the rationale here for this is just to allow us to look more deeply into the sample, right? Beyond the culture work, which is very important, but really to try to look at more in depth what genes are there, and then also more broadly, even beyond the high throughput 96 targets, really looking at the overall resistome, as I've mentioned before. Next slide. And just to reiterate, we did some initial work back in 2013 and 14 on the NERSA design with a handful of ARGs. We just did 50 mil samples that we had. We were doing quantification of E. coli and Aracocci using standard methods, molecular methods for that to look at contamination. But then we were also able to build in a certain number of targeted resistance genes as a kind of preliminary assessment of, can we see patterns? How well does this work? And this really was data that we were able to show to FDA and NARMS that built, I think, a lot of the enthusiasm and implementation of the surface water. So what we've done now is expanded on this, looked at a larger volume. Instead of 50 mils filtered in the field, we get 500 mils that we ship back to the labs. We do the culture. This work was just the targeted gene analysis. Now we do the full range of SAMP analyses, culture, targeted gene analysis, and metagenomics on all those samples. And that's the data to come, basically. Next slide. And then just shows you the East Fork of the Little Miami watershed. And the point to make here is that, again, we had an existing water quality monitoring program here that we were able to leverage. So we understood all the inputs to that system, both septic tanks and point sources of human discharge. There's a drinking water reservoir, so we actually look at both the drinking water source water quality as well as recreational exposure in the reservoir. The idea here was to develop the standardized approach for looking at a watershed, trying to understand what methods and sampling approaches are best utilized for a more focused watershed study. this particular watershed is one that doesn't have a lot of livestock. There is one pig farm in the watershed, but not a lot of animal production nor manure use in the sewer shed. And it's kind of peri-urban, right? It transitions from the far west side of Cincinnati into more rural areas. So the idea here is to kind of test drive the watershed approach, but I think eventually you would really want to look at more distinctive types of watersheds, both highly urbanized and maybe more ones heavily influenced by animal ag and animal manure sources as well. Next slide. And so, as I mentioned, I think we are done with the sampling, and right now we kind of moved right from the East Fork watershed study into the National Rivers and Streams Assessment. So we pretty much just went from one sample collection analysis to another. Now we're done with that, and we really plan to get first the watershed study publications out to really understand how valuable or not this data is, both looking at papers on each one of the analytical targets, and then an integrated paper bringing that together to really answer this question about watershed scale studies. And then when we're done with that, we just, like I said, finished the sampling with NRSA. That then we would begin to work on later this fiscal year. So next slide. I think we're that completes kind of the overview of where we're at with this One Health surveillance. But I did want to mention that we also really want to focus on translating this data into exposure risk. And let's say that if we're trying to understand the exposure risk of release of pathogens from wastewater, for example, you want to understand, what types of organisms are we interested in? What are the barriers of treatment before release? Then what maybe understand what the exposure assessment is. In this case, maybe what recreational exposure there may be. And we've used these methods in terms of quantitative microbial risk assessment already. But it's much simpler with existing pathogens, not this broader question of resistance, because there's these, what we call AMR modifying factors, which include as you think about barriers, sometimes the resistant forms, they behave differently in terms of treatment, right? They may be more resistant to treatment, so you need to modify your barrier estimates differently. We also, the whole dose response for this is complicated because we know that there's a colonization prior to this direct infection that we need to kind of really suss out, which is something that is not straightforward and not a whole lot of data for that, but really key to understanding this. And then in terms of the risk characterization, understanding what acute versus the delayed risk and maybe even the broader impacts like development of new resistance. So it's much more complicated, but this types of Q-array models are being developed for that application. Next slide. And then in terms of looking at potential mitigations, one of the areas that was called out in the 2021 National Academy of Science report, which again was a broad, far-reaching report on trying to combat antimicrobial resistance, one of the areas they mentioned was that water treatment plants, in this case, where they really mean wastewater treatment plant, is this really important linkage between human domain and the environment, right? We know that there's a lot of pathogens coming from the people. It goes through the treatment, what's actually being released. And the National Academy of Sciences report really recommended that EPA should provide guidance and resources to states to better understand that and monitor that. And since this is still kind of developmental, I think before we could go out to the state and say, this is what you should do, we really need to do more research on that to develop the best approaches. So we released a RFA last year, which is now funded, to look at two aspects. One is, what is the fate and transport of AMR through the treatment train, through both the collection system and the treatment train and release in the environment, and then also try to understand what the relative impact or proportion of release into the environment is from treated human wastewater versus other sources, like maybe animal wastewater. And when we say it could be both the treated wastewater, but also biosolids that may be utilized in the field, as well as these stormwater and CSO events of untreated sewage. So next slide. It just shows we have a number of grants, and these are the ones that are listed looking at this question. They've just got their funding this summer, so we really expect a lot of results from them over the coming years. Next slide. And finally, leave you with the one issue specifically with when you're looking at the wastewater systems, our centralized wastewater collection systems. It's been noted that, you know, there are higher levels, in this case, 20 to 20% of the total ARG and the mobile genetic elements in the total sewage came from a hospital. This was a study done relatively recently, even though it represented only 3% of the total flow into the wastewater collection system. It represented 10 to 20% of the overall load of resistance into the treatment. And so many have proposed to do pre-treatment or decentralized treatment as a mitigation form, because to get rid of the AMR, you need to use relatively high level treatment, advanced membrane treatment, and advanced oxidation, things that are more costly to do at a full centralized plant. So that is an area of this question of pre-treatment of hospital waste or decentralized treatment of hospital waste is something that we are looking at building into our research over the next year or two. So finally, just going to summarize and apologize if that was a rapid view of the environmental perspective, but just want to let you know that, you know, sampling of this surface water pilot is now complete, and we standardized methodology. We're looking at both watershed dynamics and national scale assessment. The data analysis of that really is going to occur over the next one to 2 years, and really would love to come to this kind of forum and talk about the data as opposed to just a plan. And that really is going to happen over the next very near term. And then finally, EPA is expanding our work in this area to better understand the relative impacts of municipal wastewater discharges on AMR, so that we could better manage that through some of our programs for managing municipal wastewater treatment plants. So thanks for listening.
Thanks so much, Dr. Garland. Thank you to all our presenters today. We do have a few minutes to squeeze in a few questions. So we got some questions in the Q&A box, so I'll get right to it. Starting with the New World Screwworm presentation, we got a few questions that kind of had a common theme. And the question is, so what do SMEs believe led to the sudden increase in New World screwworm? And another attendee mentioned, despite the consistently maintained barrier, what do you all believe have led to the increase?
Hello. Yeah, thank you everyone for those questions. So in regard to the increase in cases, since the original eradication, the cattle industry in the Darien, which is where that barrier, the biological barrier zone is, the cattle industry has increased tenfold in that area. So in our prevention phase, since the early 2000s, our efforts were really focused on this area. But as our cases started to progress throughout the country, we found that newer generations in other parts of Panama were not as equipped or educated on screwworm to be able to handle what was happening. We feel like for the increase in cases, a lot of it can be attributed to the movement of infested animals. The biological barrier itself within Panama was declared free of screwworm in 2006 outside of this biological barrier. Previously, we had been doing 6 flights per week of about 20 million sterile flies released ocean to ocean in that area, and maintaining 3 animal control posts just in that barrier zone area. And so like I'd mentioned, we've increased from those 6 flights per week to 21 flights per week. And so really it feels like kind of a perfect storm for the increase of cases of just the natural increase or the increase in the cattle industry, maybe a little bit of lapse or relaxation in terms of the sanitary education that we are providing to the country or region as a whole. And then overall, just the movement of infested animals. Thank you.
Thank you. And I guess I'll ask one question for Dr. Garland, if you can address, hopefully quickly, have you found difficulty in integrating AMR databases from environmental sources versus animal or human data set? If so, is this issue being resolved, and does machine learning AI assist to evaluate trends in AMR for environmental sources?
Well, that's a very good question. It's one of the areas that we're looking at within the NARMS program, using standardized methods, both on the whole genome sequencing of the isolate, say for Salmonella, as well as the metagenomic profiles, trying to use the standardized approaches so that we can compare across those domains which the NARMS program has. So because they are really thinking about the One Health, the tri-domains, the comparison is facilitated by having standardized data approaches. And the issue of using AI for that, I think, is really definitely, especially with the metagenomic data, both at the isolate level and the community, there's so much information there. I think AI is going to be an important part of trying to look at the relationships.
Great, thank you so much. So we will need to wrap up right now. If anyone has other questions, we have included the presenters' email addresses on this slide, and we will have a video of today's webinar recording posted within 30 days. Next slide, please. And if you can, please join us for the next ZOHU call on December 4th, 2024. Thank you for your participation, and this will end today's webinar. Thanks.